Good afternoon, everybody. Welcome to Fertility Diaries. I'm your host, Nkechi, NK for short. If you are new here, this is a space where we talk about fertility openly, the struggles, the emotions, and most importantly, the hope through the journey. Today, we have a friend of the house, and this is episode 14. We'll be talking about male factor infertility. Let's talk about the men as well. So today we're going to be having our guest, the renowned specialist, fertility specialist, Dr. Chukwudi Ufondo. He is a coach and a fertility doctor who has dedicated his career to supporting couples on their journeys to parenthood. Dr. Chudi is a friend of the house and a very patient-centric person. He's also the convener of Soul Spirations Global Health Solutions, SGHS, a social media-based women's health network, strictly focused on fertility and how to overcome it. So he's going to be talking to us today about male factor infertility. Doc, welcome to the house as always. Thank
Yeah, thank you
you.
so much, Nkechi.
Thank you.
It's
All
always
right.
a pleasure and it's always a big privilege to
So,
join your community. And the reason is very simple. I'm a specialist in maternal and child health, and there is an intersection with what you do, bringing knowledge, bringing light into the darkness of infertility, using simple knowledge to overcome infertility. So I'm so excited, and I always look for opportunity to share my experience to help couples overcome infertility, especially the male aspect of infertility, which over time is poorly understood. And most men blame women when it comes to infertility. So it's really going to be a very big opportunity for us to look at men. Most times we dissect women, but let's dissect men and see what's going on with men. So thank you so much. I look forward to a very good opportunity and sharing my knowledge.
thank you so much, Doc. So before we delve in, it's our tradition here that we have a Bible passage for the day. So today we're going to be reading Isaiah 41, verse 10, the NIV version. And it says, "Do not fear, for I'm with you. Do not be dismayed, for I'm your God. I will strengthen you and help you. I will uphold you with my righteous right hand." So through fertility journeys, there's always this anxiety that comes with, period has come, one thing or the other. Everybody's always so anxious. And this is God reassuring us that He's with us. We should not be scared. He is our God. He will help us, He will hold us through the journey. So I hope that you can sit down, meditate on this word, and get a message for yourself. The journey of fertility is very personal, and it's between you, your spouse, and God at the long run, and your experts who are guiding you through the journeys. Let's start, Doc. Let's even begin from the foundation. What exactly is male factor infertility?
Okay, thank you so much, Nkechi. So, first of all, let's actually understand the concept of fertility. Today, this is the female internal reproductive system.
Yeah.
I used to have the male version, but for some reason it's very fragile, so that one collapsed. So, for you to be fertile as a woman, it simply means this whole structure will be working perfectly. The vagina, the cervix, the womb, the tubes, and the ovaries. Now, for the male counterparts, it's also important that the external and the internal male reproductive system is working in tandem with the females, and it's important that the man is in good health, especially the reproductive system. So, if the reproductive system is working perfectly, it's expected that when the man comes of age, which is puberty, the man will have the ability to produce sperm. And if the man is producing sperm at the peak of sexual intercourse with the woman, the man will ejaculate. When the man ejaculates, it's expected that inside that semen, we have millions of sperm, out of
Yeah.
which only one will gain access to the egg that is released in the tube, and fertilization will start. So when you have male factor infertility, it simply means the woman is perfectly okay. All her systems are working, but the problem is coming from men. So the inability to get your woman pregnant, despite the fact you guys are making love regularly. In my community, regularity is every other day. for couples
Yes.
that want to have their babies.
Yeah.
So every other day means today is Saturday. If you make love today being Saturday, tomorrow being Sunday, you can have a break. Monday, you can continue. So if you have been regularly making love with your partner as a male, and at the end of the day, you are not able to get her pregnant. And when we check both of you, we discover that the woman is okay, she's ovulating, the tubes are okay, the womb is okay, but you're not getting her pregnant. And when we check your sperm analysis, so every man that is currently going through infertility is encouraged to go for SFA, semen fluid analysis. So we simply look at the sperm, we look at the
Okay.
count, we look at the morphology, we look at the motility. So if at the end of checking all these and a couple of other things, we also do the hormones, and we discover that the problem is coming from you, at that point, your type of infertility is classified as male factor infertility. Now,
Infertility.
male factor infertility is a broad spectrum definition.
Very broad.
So you
Yeah.
can have primary male factor infertility or you can have secondary male factor infertility. In primary male factor infertility, it simply means from the point you started making love with your partners in the past, it might be your girlfriend, it might be whoever, you've not been able to get any woman pregnant. And
Okay.
currently, you're still not able to get any woman pregnant. Subsequent to confirmation that that pregnancy is yours, because anybody can tie a pregnancy to you, but if you guys don't go for
True.
check, you might not
Very
really
true.
confirm that that pregnancy is actually yours.
Yeah.
So if you were not able to get a woman pregnant all the time in the past, and still currently you're not able to do that, you have primary male factor infertility. If you were able to get a woman pregnant in the past, but currently due to changes or you suddenly started developing some factor problems and you couldn't get a woman pregnant right now, let's say in 2023 you got so many women pregnant or you got your wife or your girlfriend pregnant, but in 2025 and 2024 you couldn't get her pregnant, at that point you have secondary infertility. So secondary infertility is easier to manage compared to primary infertility. That's the simple definition and explanation of male factor infertility. Thank you.
All right. Thank you, Doc. That actually opens, my horizon for me to even understand what it really means. So, what are the common causes? What really causes this? Because I'm sure everybody's wondering, okay, you've talked about the morphology of the sperm and all that. What causes, male factor infertility?
Okay, so it can be a myriad of factors, but I'm going to make it very simple.
Okay.
It's always good to start from the simple, then you go to the complex. As a man, everything that affects your general health can affect your reproductive health. So,
Okay.
for example, stress, poor sleep, anxiety,
Okay.
depression,
Hmm.
anything that affects the totality of how you function can affect your metabolic system, can affect your general system, and by default can affect your reproductive health. So, for example, if you don't eat right, if you don't sleep properly, if you have a lot of stress in your life and you develop some medical problems, it's going to affect your sexuality. It's going to affect your libido. It's going to affect your ability to achieve erection. And if you can't do that, your civic responsibility as a man is to achieve erection and make love to your partner. So if you can't achieve that specific, role, a duty as a man, you failed. You can have, self-inflicted or human mediated fertility problems, which can easily be solved when you improve those conditions. So, lifestyle can be a very big factor, a big risk factor, and cause of male factor infertility. But when you now begin to go to the bigger ones, we talk about the sperm quality, which is actually the commonest. So, sperm quality means if we check your SFA, semen fluid analysis, we
Yeah.
discover you have low sperm count. Low sperm count is called oligospermia. So there's a particular number of sperm you're supposed to have, which will qualify you as being normal. Now, this is very interesting because per ejaculate. So ejaculation means when you release that fluid from the penis at the peak of sexual intercourse. For an average healthy man, you actually have up to 39 million sperm. So the sperm
39.
is not visible to the eyes. Yeah, it's a lot. You're in millions. But guess what? It's only one sperm that will eventually get the egg fertilized. So remember, a woman will only release one egg, but per sexual encounter, millions of sperm will be released,
Or being
out of
released.
which only one. So do the mathematics. So this will tell you how unique women are. So in course of doing that, and we discover you have low sperm count, poor motility, poor morphology, then you can have that male factor problem coming from the sperm quality. So a man that has low sperm counts can still get the woman pregnant if the quality of the morphology and the motility is there. If it's the other way around, then the possibility will flip. So you have lifestyle mediated male factor infertility, you have the sperm quality male factor infertility, then you have the hormonal imbalance. There are specific hormones that can help a man to, produce all those hormones that will help to initiate the male aspect of making babies. If that hormone is not within normal range, especially the testosterone, then we can also have male factor infertility.
Yeah, okay. Thank you so much. So, from what I gathered, you said lifestyle factors, hormonal imbalance, which I was really surprised because I actually thought it's just the women who have hormonal imbalance. And then you
No,
said low sperm counts.
correct,
Okay. All right.
correct.
Then the morphology of the sperm as well.
Correct. So of the three qualities we look out for the sperm,
Yeah.
we are actually more interested in the motility because you can have low sperm count, but that sperm is able to swim from the vagina into the tubes, and the sperm can
Oh,
still get the woman pregnant. So if
okay.
you have very good sperm, but it's not swimming, it's not going to get the woman pregnant. Now, morphology means how the sperm is looking. A good
Yeah.
sperm is supposed to have a head, a middle piece, and a tail. So if most of the sperm they produce is not of good quality, pregnancy will also not happen. So of the three parameters, we are much more concerned with the motility and morphology, less than the count. A man with low sperm count, if he continues frequent lovemaking, can still get a woman pregnant. Now, if you
Okay.
talk about hormones, of course, the same hormones women have, men can also have them. So men also have estrogen and all those FSH, LH, but the quantity is unique to men. It's only when it flips. So if a man has a lot of estrogen, higher
Yeah.
than he should have, the man will not be able to get a woman pregnant. In the same vein, for women that have polycystic ovarian syndrome, one of the hallmarks in polycystic ovarian syndrome is a lot of production of the androgens, which is a
Androgen.
male-mediated hormone. So yes, hormone imbalance is a big player in male factor infertility. Also, your general body weight. So if a man recently added a lot of body weight, so if the body mass index, which is the index we use in checking if the man is out of range regarding the body weight, if it's higher than 25, and some men are in the 30s, you've got a problem. You need to work on that. So the good thing about male factor infertility is the fact that if you modify your lifestyle, you can actually improve your fertility simply by modifying your lifestyle.
Oh, okay. That's really good to hear. So if someone is obese and have had issues with male fertility and decides to get into shape, do exercise, his chances are higher that he would come out of it.
Correct.
Yeah. Okay. All right. So I know you mentioned lifestyle. Are there any other medical conditions that might affect male fertility?
Correct. Yeah, definitely. Some men inadvertently might have developed diabetes. Some men might have developed hypertension. And hypertension and diabetes are two big culprits when it comes to chronicity of diseases. So if you have diabetes and it's poorly treated, it's poorly managed, or even when you're managing it, some of those medications you use in managing diabetes and hypertension can also affect your sexuality, can also affect your libido, and they can also indirectly mess your whole body up. So they might not directly cause infertility, but if you don't manage it properly, it's going to distort the whole body function. Like, for example, if you have diabetes, depending on the type of diabetes you have, we have two types of diabetes, broad spectrum. We have the type 1, which is insulin dependent. Then we have the type 2, which is insulin non-dependent. So depending on the type you have, the problem we have in diabetes is the inability of insulin, which is the hormone that handles the sugar in the body, to perform its optimal function. So sometimes you don't produce insulin at all. Sometimes the one you produce is not sensitive. So you tend to accumulate a lot of sugar in the blood, a lot of glucose in the blood, which will now cause problems regarding what the sugar is supposed to do. So they can inadvertently affect your reproductive system and lead to infertility. So then there are a couple of other medical problems you can also have. Some men can also have some endocrinology problems. So endocrinology problem means some abnormality in the way your body produces some hormones. And also some men can have some congenital problems. So there are some men that might have a problem we'll call undescended testes. So normally your testis develops from the upper centers of your body and now descends into the scrotum. So in some cases, when they were developing, the testes refused to come down and got arrested in the route of coming down. If we don't identify this and surgically correct it, that kid might grow up and be looking cool, but that kid is not going to get a woman pregnant until we resolve it. So there are myriads of problems that can lead to male factor problems in men.
Thank you, Doc, for being very explicit with us. All right. So, what are the types of diagnostics? How do we diagnose a man has a male factor infertility?
Okay, now it's very important that the couples are on the same page. One of the biggest ways of overcoming infertility, regardless of if it's coming from the man or the woman, and sometimes we won't even figure out where it's coming from. We just know that both of you are not able to have babies. So that particular type of infertility is called infertility of unknown origin or non-specific infertility. So, but for the men, everything starts with complete medical assessment. So complete medical assessment means when you present, when you notice that you're not able to become pregnant, depending on the age of the woman. So the woman is actually the person we would normally use to classify infertility using age 35. So if a woman achieves age 35, at that point, she's classified as being in advanced maternal age. The reason is because as you're getting older, you have fewer eggs, and those fewer eggs are of poor quality. So by that time you get to age 35, you would have lost a lot of eggs. So you have fewer chance of becoming pregnant naturally. So if you married a woman that is 37, and after 6 months, you guys are making love regularly and you're not able to achieve pregnancy, then at that point, you're going to present a fertility specialist. A fertility specialist will focus on the man when we are doing the evaluation of the male aspect of infertility. It starts with history. We're going to take a lot of history. We're going to ask you a lot of questions. There are some men that had some surgery in the past, and because of doing those surgeries, they might have damaged the male system. Some men might have heniorrhaphy. Some men might have had trauma growing up. So anything that leads to any procedure in your body, depending on how it's done, can lead to infertility. So we take your history, we examine you. When we're examining you, we're going to examine the penis, we're going to examine the scrotum, then we're going to send you for some investigations. So part of the investigations is to look for semen fluid analysis. So we ask you to produce your sperm for analysis. We check the count, we check the motility, we check the morphology. We run your blood for hormone profile. So we check all the hormones I mentioned: estrogen, progesterone, FSH, LH, prolactin, testosterone. So the levels will give us an idea of the direction you're heading to. So when we've tied everything together, we can now categorically say that based on this, based on the semen fluid analysis, based on the examination of the scrotum, based on that, based on how the person presented, we can say that this is the problem. There are some men that have dilation and swollen veins in the scrotal area, which can also be a very big common cause of infertility. That condition is called varicocele. So if we find out anything related to any of this, then we would have solved that problem by 50%.
All right. Thank you. So, I will really say I've heard a lot, and I'm sure our listeners are learning a whole lot from you today because you're actually opening our eyes to a lot of things. So, from what I've heard, you have to check the sperm. You talked about hormone testing, sperm analysis, and all that. How do we now, evaluate the quality of the sperm?
Yeah, that's a very important question. And this is an
Yeah.
area that so many men are really, really giving their women problems. Now, men, listen to me. If you're a good man, if you claim to love that woman, if you took your vows for better, for worse, when you're having delays, having a baby, it's part of your challenge. It's that worse we're talking about. So you have to stick together. Now, women are very easy to go for their test. We draw their blood, they do their scan. Anything you tell them, they're very, very easy to go do. But most men are not able to cooperate with the women to go for their sperm analysis. It's you that will go, you, the man, will go there. And when you get there, you're going to masturbate to produce the sperm. There are alternatives, but we want a clean sample. So you go there, You're a man, you're a healthy man, there is nothing wrong with you. The same way we collect your blood, you're collecting it for investigation purposes. You're not doing it like your habit or your lifestyle, because some men will be like, oh, I don't do that. There are some men that go to the lab to submit their sample and they won't submit their sample. When you're doing all those things, when you have a lot of anxiety and stress in you, you can't produce the sperm. So when you go there and you collect that sperm, we're gonna ask you to abstain from sex or any ejaculation for 5 days, so we can be sure of the quality. You're going to submit the sperm for analysis, and the laboratory people will run the sperm under the microscope and check for the count, check for a couple of other things. We were interested in 3 things: the count, the motility, and the morphology. And at the end of the day, they will give us a report if you have normospermia or if you have oligospermia. Oligospermia means you have reduced count, and a couple of other medical terminologies we use for the morphology and the motility. So that's how we know the quality of the sperm.
Right. Thank you, Doc. Okay. So, when I was researching about this, I saw something about genetic testing. What's that
Correct.
about?
Correct. Now, in genetics, so genetics is simply the study of your basic unit makeup. So you're a product of your mom and your dad, like Nkechi. The reason why you're Nkechi, this beautiful lady smiling from ear to ear, is because your mom and your dad came together. Your dad had 2 options, but your dad chose to give his X chromosome. So when we talk about genetics, we break it down to the chromosomes. So males will have XY chromosomes. Women will only have XX chromosomes. So for you to be a woman, your daddy donated his X chromosome. Your mom can only bring the X. So XS chromosome for women, when we begin to break them down, to look at the genetics, to look at possibility of some disorders in cause of this, in cause of that, then we can begin to find out some stuff. So there are some men that can actually have some genetic predisposition. There are some men that can have some genetic problems. For example, there are some men that might have a predisposition for things like Down syndrome or all those big names you hear about. I don't want to confuse anybody with medical terminologies. But when we go for genetic disorder checking, we are actually checking for certain things that might run in the family. There are certain disease conditions that can run in the family, which we can easily pick up from genetics. I will give you one example. If we have a man who is probably Romeo and we have a woman who is probably Juliet, and so both of them are so in love and they have gone deeper in love and they suddenly discover that they are both AS. If they really want to be together and if we want to make sure they avoid having kids with sickle cell disease, we're gonna go for a lot of genetics. We're gonna do a lot of genetic testing to rule out a couple of things, which we will now narrow down to only the embryo that won't have sickle cell disease. So in that situation, they're gonna go through very carefully planned IVF process, selecting only the quality that will give us AA or AS and avoiding SS. In the same vein, when you're going for genetic testing, you can easily rule out all this syndrome, that, which can actually increase as you're getting older. So the older you are, the more the possibility that when you give birth to your baby, both for the males and the females, possibility the baby might have some syndrome is very high. Some genetic problems.
All right, thank you for that. So let's talk about treatment. What are the treatment options available for maybe low sperm count or generally male factor infertility?
Now, if we talk about management of male factor infertility compared to female factor infertility, male factor infertility, I don't know, for some reasons, I've always said this. God, for some reasons, God was biased when he was creating men. God gave men a lot of leeway. The only role a man is playing in this process of reproduction is to bring the sperm. That's the only role. Once the man is done with the producing the sperm, that's the end of the story. The man will just go and be, rejoicing that I'm gonna be expecting a boy or a girl. It's the woman that will go through all this. It's the woman that will eventually go through the 9 months, breastfeed the baby. So there's a lot of burden on women. And in the same vein, if you noticed, we are talking about women producing 1 egg every month, and those eggs can finish. So your eggs are in your ovaries. So by the time you finish, then you go into menopause. You will no longer have ability to become pregnant naturally. But guess what, for men? you will continue to have that ability to impregnate a woman so long as you have sperm. So men in their 80s and 90s can still impregnate a woman. In the same vein, the biggest factor in managing male factor infertility is lifestyle modification. The reason is because in the same vein I'm talking to, God is our father, so we talk to God like a father and a son. God gave men the ability to produce 39 million sperm per ejaculate. So imagine if you're practicing PPP in a week, if you're diligent, if you're conscientious, if you don't complain, I'm tired, I'm this, I'm that, and you really want to start your family. So imagine 39 million sperm by at least 4 times of sexual intercourse in a week. Imagine the quantum of sperm you're producing. Now, the biggest impact, the biggest advantage that God gave men is the ability to reproduce new sperm. So your sperm in 3 months, the old ones will be replenished by producing new ones. So, for example, if you were living carelessly, drinking, smoking, not exercising, added a lot of body weight up and down, doing all those stuff, but suddenly, like the prodigal son, you go back to your father and you tell your father, Father, forgive me if I have sinned. And you switch away from your old ways and you begin to do the right things and you begin to turn around, you begin to live healthy, you begin to sleep, you begin to avoid all those things that can actually affect you negatively. By the time 3 months comes and you're producing fresh sperm, you would have improved those poor sperm quality. Now, some men will be given some treatment depending on the cost. So the management of male factor infertility is based on the cost. So lifestyle modification, modify your lifestyle. Everything you're not supposed to do, don't do them. Everything you're supposed to do them. But there might be some men who need to give some fertility drugs. So some men might be placed on some hormonal drugs. Like, for example, if you have problems with your testosterone, we can give you hormone replacement therapy. And some men might also be given some other drugs we use in managing infertility. And some men can also be placed on supplements. But here's the deal. There are no quick fixes. So, lately there are some gullible, providers. There are some people that are not even doctors. But they will go and brand something and tell you, oh, if you're having sperm quality problem, if you take this, it's going to multiply your sperm. It is not true. There is no magic drug that multiplies your sperm. There is no magic supplement that multiplies your sperm. There is no magic supplement that fixes the problem you have. The only thing that can fix it perfectly, evidence-based, is your lifestyle. Whatever we are giving you is a supplement. Like there's a particular supplement we call Manix and all those other stuff. They are supplements. They are supplementing. Their contribution is less than 1%. So, but if you modify your lifestyle, if we discover a particular problem, if you have something like varicocele, which we can correct surgically, we can correct it. Then you improve your chances of becoming a father. Now, some men can have what we call azoospermia. When you have azoospermia, you can produce a lot of semen, but when we check that semen you produce, we will not find any sperm. So when we check your sperm, you have 0 sperm. And a 0 sperm cannot get the woman pregnant. Now, azoospermia is a very worrisome thing to happen to a man, especially knowing fully well that men have a lot of pride. So imagine that you're a handsome, tall man with a lot of money, not being able to produce, and we go and we tell him, hey, young man, with all this your pride, you don't have sperm. It's going to kill his image and all that. But thankfully, depending on the type of azoospermia you have, we broadly have 2 types of azoospermia. So we have obstructive azoospermia and non-obstructive azoospermia. Obstructive azoospermia means something is blocking it, so we can unblock and we can bypass and we can still produce sperm. But if you're not producing, that's where the problem comes. So there's a lot of things lately we've been doing in the male aspect of infertility. Now, ultimately, if you're not able to get your woman pregnant naturally by the time we've done all this improvement, then we can take over. So taking over means we're going to use what we call assisted reproductive technique. When we are using assisted reproductive technique, we are taking over the function from the man. So ordinarily, you put your penis inside your woman's vagina, you ejaculate, you get her pregnant. But when you have failed to perform that duty, so when you are not able to perform your duty as a man, we can come in and quickly take over that function. So we can start a management protocol we call IUI, intrauterine insemination. So in intrauterine insemination, what do? We still take demand for semen fluid analysis. And if we get some fair kind of good sperm, we can treat those sperm, we can spin the sperm centrifuge, collect some good quality sperm we got from your own sample. Then we'll introduce it directly into the womb. That's the insemination simply means putting sperm. So intra means inside the womb. So we put it inside this womb with the understanding that at least you have one open tube, with the understanding that the woman would have ovulated. So what we are doing in IUI is to create an enabling environment for the sperm to swim to the tubes and get the woman pregnant. Now, some couples will need to go for IVF. In going for IVF, we're going to collect the woman's egg. We're going to collect your sperm outside the body of the woman. Then when we achieve getting the embryo, we put it back into the body of the woman. After 14 days, you go for your test. And by the grace of God, you're going to become pregnant. So these are the different options in managing male factor infertility. And of course, some men will require donor sperm. So if we check all this stuff and at the end of, for example, if you have azoospermia, if you want B, Dangote, if you want be the richest person in the world, you have to come down from your high place and open up for donor sperm. So if you have sperm that has zero sperm, you can't get your woman pregnant. But if you still want to be a father, you can use donor sperm. Nobody will know what you did and you can still start a family. This is where maturity comes in.
Okay. Thank you very much, Doc. That has really, really cleared a lot of doubt for me. So in the case where the person is more of, is not the azoosperma and is not IVF the person needs, maybe it's hormonal imbalance, drugs can be used, right?
Yes.
To just,
yes, depending on the outcome of the assessment. Yes.
Okay. Okay. What about surgery?
Yeah.
People
Like I
need
said, if
surgery
you
at
have
any time.
varicocele, so if you have those swollen, distended veins in the scrotal region, there are some very sensitive, carefully conducted surgery we can use to correct that. And when we correct that, we improve your chance of becoming pregnant. So surgical correction can also improve male factor problems.
Okay, thank you. I was going to ask about ART, but you've already explained it.
Yeah.
And you've also talked about IUI.
Correct.
And also using donor sperm. So that has cleared the air. So in the event that the person, after all the treatments, nothing can be done, then there are different options the person can take. Either a donor sperm, or you go for IVF, or you go for IUI, or you go for ART. So that's actually solves a lot of problems. There are options out there. So our men should not be scared. So, like you said, men are normally proud, and carry themselves in a certain way. What are the emotional toll? How do they handle it?
Yeah, so like I said, consider the woman you're planning to start your family with as your friend. Friends open up to each other. It's tough to be going through delays and having a baby. It's the toughest thing that will happen to you. It will rock your foundation, especially for the women. Women wear the emotions on their shoulders. But as a man, you have to support your woman. One of the best ways you can support your woman is to show up, go for all the consultation, attend master classes, get your own information, avail yourself of that opportunity to go for your own test. Have some good friends around you. Have some people you can go for counseling. Make sure you're healthy. Make sure you're nurturing your relationship. Make sure you're not just making love for making babies purposes. Create the bond. Cement each other's relationship. Understand that this is a phase. Be mindful of who you talk to. Don't be in a haste. Modify your lifestyle. Every problem has an expiring date. If you do all this, you will blink and matter of fact, before you know it, you guys will start using contraceptives to reduce the number of babies you want to have. So it's all about understanding and actually putting that love and that vow you took when you were getting together, put them into practice. Your infertility is for the worst, so you stick together for the worst. It's not all the time it's going to be bed of roses. So that's the secret.
Thank you. So that response actually even answers the last question I wanted to ask. I wanted to ask her what are the support and how can couples also support each other. And you've spoken about it that they need to bond. The man needs to know that, oh, it's not just about the woman here. And because he loves her, he needs to show her that, they are in the journey together. They should have a community, talk to the right people, and then, build relationship. Don't make love because, oh, I'm looking for a child. Make love because you are actually having fun and loving each other. So
Correct.
thank you so
Correct.
much.
Correct. I
Thank you
mean, at
so
the end
much.
of the day, just remember
Yeah.
this. If there is anything you can take away from me, if God was able to give Sarah a baby,
Yeah.
your case is like a case. Now, there are so many things you can explain. There are so many things that happen when people are desperate. You know that Sarah in the Bible had to go and look for a handmaid for Abraham and all that. There are so many things that happen. But please avoid dragging third parties into your relationship. That third party might be your mom. That party might be your father. It might be your siblings. It might be your friends. It might be your pastor. It
Yeah.
might be anybody. You're not doing anybody any favor. The woman is not doing the man a favor. Some women will be like, I would just want to give him a baby so that he will love me and change. It's not true. People will always be who they are. You just have to understand that both of you wanted this. Both of you are in it. Both of you will solve the problems. Both of you will reap the dividends. So as a woman that wanted to actually settle, you don't go telling your mom every little thing that happened and you create a lot of friction. Life is already stressful. So when you guys don't handle this properly, you're going to make an already complicated situation more complicated.
Very complicated.
So avoid third parties. Avoid them. Like you have to keep some boundaries, especially the woman, your mom. Your parents can actually be the biggest problem you have.
Yeah.
Your family. I'm keeping it real. I'm telling you the truth. You can love them, but sometimes you love people from a distance because this is your own family you're trying to set up, not their family. Your mom will finish. Most mothers are also selfish. They're just interested in having their grandkids. Some of them will not even ask you how emotional. There are some women that are depressed. There are some women that are suicidal based on the fact that they couldn't have their own babies. It's
Yeah.
their mom that pushed them. Your mom will begin to compare you with your sisters, with everybody. What are
Yes,
you guys doing? Why are you not giving me this? And before you know, you're putting yourself down and you can develop mental health problems. You can be depressed. You can be suicidal. You can lose the quality of your life. Now, guess what? At the end of the day, you're going to be a mother any which way. But you want to be a mother in good health. You don't want to be a mother, then you leave your kids in this crazy, wicked world for people to look after your kids. That would be the worst mistake you make. So I would rather you don't have a baby than to have a baby, you die before your time, then you leave your baby with your husband that will marry almost within 2 months with another woman. You don't want that to happen to you. You need to be smart. Okay?
Yeah.
All right.
Thank you so much, Doc. All right. So are there like new emerging technological, advancements in the area? How has tech been able to help in the treatment, or is just, purely all medical?
Yeah. I mean, there are so many advancements in, technologies like I've mentioned ART. So we have newer advancements which we call ITSKI. So in that situation, instead of just getting quality or couple of sperm and egg, we directly inject the sperm into the egg, and it has a very high successful rate. So there are so many newer trends. There are ways we can go to the bedrock of where the sperm is produced, and we take the cells and see if we can get some sperm there. So you just have to be ready to try new things out there. Budget a lot of money for starting your family. Unfortunately, we are too smart.
Yeah.
When we are making our budget in January, we budget 90% to fun, to impress people that don't like us. So imagine impressing people that don't like you, and at the end of the day, they won't like you, and you wasted your funds. But if you
Funds.
budget that 90% to go into the best, you might not build houses, you might not buy cars, but you have your babies. And the entrance of your babies will bring you good fortunes. So you need to seek help. The earlier you seek help under someone that knows, the specialist, the earlier you guys are going to solve this problem. This is a problem that will expire. It's not going to be forever.
All right. Thank you so much, Doc. Thank you for enlightening us today. You've broken it down so clearly and compassionately. Thank you so much. We
You're
really
welcome. You're welcome.
appreciate you.
You're welcome. It's a
And
pleasure to
it's
be back again, and hopefully you
yes.
put this into practice. And if you happen to be a follower of my community, Remember, I show up pretty much every day, during my
Yes.
lunch break. Then every last Sunday is my master class. So if you're currently having infertility, in hearing this, male factor, regardless of the type of infertility you have,
Yeah.
you can leverage on getting support. We can help you. I've helped thousands of people to become pregnant. I've helped thousands of people to defeat infertility. There is always something you haven't done. So don't
Yeah.
think you've done everything. There is that particular thing you're fearing you won't do that you need to do. The cave you're afraid of is the cave that has the keys to your treasures. So go above and beyond. Be careful. There are so many people that will take you to the wrong places, deceive you, take your money, and at the end of the day, you won't have your babies. There are so many people that they've given other people's babies to them in name of cricket pregnancy and all that. Be careful. There are so many people out there that will deceive you, that will monetize the infertility problems you have. So be careful. And thank you for this opportunity.
Thank you so much. Thanks, Doc. So, to our listeners, thank you for joining us this very necessary conversation. Infertility affects both male and female. And the more we talk about it, so that the understanding and awareness is clear to everyone, it will be good that we all take that advantage. So don't forget to follow us. Don't forget. And Doc mentioned his masterclass end of the month. I will drop the link when I'm posting this video. If you know that you want to get help, this is the right channel to get help. And if you attend one of those master classes, you come back and thank me. And it's not expensive. So budget for it, and I expect to see you there. So I will drop the link when I'm posting the video. So you can connect with us on social media handle. Our Instagram account is Infertility Diaries TV. On YouTube is Fertility Gist. On Facebook is Fertility Diaries, and Spotify, because our earlier episodes were audio and they're on Spotify. This video will also be on Spotify. So you can just search for us, Fertility Diaries. And if you want to reach out to us, or you want to just drop us a comment, you want to be our guest, you can send me an email, infertilitydiaries87@gmail.com. So subscribe, share this episode, because this is very important. The next man yet beside you might just need help, and he doesn't understand. But with everything Doc has said, it's simple and it's clear. You can actually, from this, go to your fertility doctors and seek help. Don't wait till it's very late. Please don't wait. All right. So please leave us a comment, send us a message, and remember, you are not alone on this journey. Until next time, stay hopeful. This has been episode 14. I'm your host, Nkechi, signing off with love and light. See you next time. Bye bye, everyone.
Adios. Bye.
Bye.